and welcome to our special show Health and Wellness. I'm Gargi Rawat. The topic of men's health, both physical and mental, is often swept under the rug. It's important to remember that men's health is not just a man's issue, it's a family issue and can impact everyone around them. Hormones play a powerful role in the body's regulatory system, and proper hormonal balance is essential to maintaining optimal health and also plays a crucial role in how one feels. While it's common to associate hormonal disorders and imbalances with women, many hormonal imbalances are also seen as signs of aging or even inadequacies in men. Like women, men also undergo changes from childhood, and these include physical and hormonal changes. Men tend to accept changes in their bodies as part of the aging process. However, most symptoms of aging are actually caused by hormonal imbalances, and it's true that as men age, they are more likely to experience male hormonal imbalance. But there are also other contributing factors. Fortunately, male hormone imbalance can be successfully treated. Living a long, healthy life is easy if you know the symptoms and prevention strategies. Today, we have with us eminent endocrinologists who can help us understand and manage men's hormonal health. Let's go across to our panel. We're joined by Dr. Manash Pratim Baruah, endocrinologist, Apollo Excel Care Hospital, Guwahati. Dr. Parag Shah, consultant endocrinologist, Gujarat Endocrine Center, Ahmedabad, and Dr. Sambit, senior consultant endocrinologist, Endeavour Clinics and Apollo Hospitals, Bhubaneswar. Thank you so much, doctors, for joining us today. And Dr. Baruah, first question is to you. Just like females go through hormone imbalances throughout their lives, if you could explain about what happens to men, and can you enlighten us on the hormonal imbalance men face in their day-to-day life?
Yeah. That's an important question. Actually, male, like female, also go through different transitions in life, starting from childhood to adolescence, and then adolescence to adulthood, then middle age, then old age. In females, we have two milestones. One is menarche, which is the first menstrual cycle, and the menopause, which is the last menstrual cycle. So these two are quite dramatic, and then you can make out, and it's quite easily you can understand that there are two different stages of transitioning from one stage to another. But in male, that kind of transition is not very evident because it is very subtle. Of course, in puberty, you can say that male persons, because of increased testosterone, which is rising and which is going to attain the adult level at the age of 20, there will be different behavior in the pubertal boys, like aggression, and the muscles mass are increasing, and the facial hairs are appearing. So appearance is changing. But otherwise, throughout the middle age and the late adulthood, the changes are so subtle that sometimes you cannot make out, and that's because the testosterone level, once it rises to the adult level at the age of 20, it remains at a very high level till the age of 80, and that's why the subtle symptoms cannot be perceived. Nevertheless, the symptoms of low testosterone are a lack of concentration, or depression, anxiety, obesity, that is increased fat mass and decreased muscle mass, decreased muscle power, and sometimes you suffer from more cardiovascular disease because of low testosterone, and your ability to perform is decreased. And finally, most important fact which is often missed out is actually poor bone health in hypogonadal male having low testosterone, because testosterone is very important for retaining the bone health, and without testosterone, male person can have severe osteoporosis, which can lead to high incidence of fractures. Big bone fractures, which we usually see in our patients. Another factor which has to be remembered is the lack of libido, and decreased ability to have a good sexual intercourse is also seen in male patients with low testosterone.
All right. Now, Dr. Shah, hormonal imbalances are an unfortunately common issue for men. What causes these imbalances?
See, apart from Dr. Baruah has mentioned, stress and the present lifestyle, which is a sedentary with a bad dietary habits, leads to the central obesity, what we call the abdominal obesity, leading to insulin resistance, where insulin is produced but it is not efficient, which ultimately translates into the diseases like diabetes, hypertension, cholesterol problem, and cardiac problems also. So apart from age-related decline into the sex hormones, there are certain hormone disorders like thyroid adrenal, pituitary hormones, which comes from inside and does not come from outside. Whether it is coming from the autoimmune disorders where the certain antibodies does not allow the glands to function properly. So either hormones are produced in excess or produced in the less quantity. So such diseases are not related with the external factor, but it is related. So it is not specific for the males, but it is also a very common diseases. So most of the hormone disturbances can be clinically diagnosed, can be tested very easily in most of the lab with the lab investigations, and after the proper diagnosis with the proper treatment by a hormone specialist or endocrinologist, all such diseases which is related with the hormone disturbances, patients can expect a trouble-free, smooth, good quality of life with an excellent longevity also. That is the beauty of the proper hormone treatment, that it can lead to the absolutely healthy life for rest of their life.
All right, Dr. Das, so we're talking about men experiencing these hormonal imbalances. How do they know what they're going through? What are the signs that you're experiencing this imbalance?
Yeah, thanks for that question. In fact, the signs and symptoms of male hormone deficiency actually depends on which age it has actually developed. So, for example, the male hormone or the testosterone deficiency can occur at an earlier age. And if that happens, the boys will have delay in their maturity or delay in puberty, we call it as in medical terms. They will have poor secondary sexual characters. There might be lack of beard, and there would be proportion problem in their body habitus. Some people have longer lower limb compared to the upper half, so that we call it as unicoidism. And it's very easy to diagnose this kind of hormone deficiency when it occurs at an earlier age or during the teenage period. But when the male hormone deficiency occurs at a later age, as Dr. Baruah is telling, there is a condition known as late onset hypogonadism, maybe at a middle age or maybe in elderly. The signs and symptoms would be quite subtle. It would be like only a depression, depressed mood, increase in the abdominal fat accumulation, muscle weakness, maybe some muscle atrophy, and there would be profound decrease in the libido, and erectile dysfunction and male sexual function can happen. Infertility can happen. So in contrast to boys who have, or at a younger age when there is a hormone deficiency which is quite significantly known to the person or to the doctor, adult onset hypogonadism is quite subtle, and one must ask questions to get the answers of these signs and symptoms actually.
All right, and awareness is the first thing that's important, to check hormonal imbalance. Dr. Baruah, what is the role of the prostate gland and what are the disorders associated with it?
Yeah, prostate is an integral part of the urogenital system in adult male. It is situated just below the urinary bladder, and actually it's kind of surrounds the urethra, which is the outlet from the bladder, which takes out the urine. So normally, the prostate secretions increases the sperm quality. That's the main function. But otherwise, prostate, only we remember prostate when it is pathological. There is a condition affecting the prostate. And the most common condition which affects the prostate after the age of 50 years is something called benign hyperplasia of prostate, which is a simple enlargement of the prostate, which is not dangerous, which can be treated by medicines, and rarely they might require surgery like transurethral resection. The next common prostatic disease is prostatic cancer, which is probably one of the most common cancers adult male would have. But luckily, prostatic cancers, by and large, at this present time, is curable with surgery, chemotherapy, and also in selected cases maybe radiotherapy is also useful. But nevertheless, if prostatic cancers are neglected, there may be distant metastasis in the bone or liver, so vital organs. So that has to be remembered. Early detection is a key. And third common condition which we see in prostate is the prostate infection or prostatitis, which is pretty painful condition and pretty toxic conditions. But again, it can be managed, by antibiotics, and also putting a drain to the prostate and draining out the pus which can get collected. But sometimes all these conditions may lead to urinary disturbance or even bleeding in the urine, or something called hematuria, or retention of the urine, which is the complete absence of urine, ability to pass urine. So these conditions may happen. Otherwise, usually in prostate conditions, patients may have nocturia, increased frequency of micturition or urination at the night, or sometimes patient cannot hold urine, something called incontinence, which is where urine is passed out spontaneously without the ability of the person to control it. And sometimes you may have retention or inability to pass out urine, as I have already told. So these are the conditions we usually see in a patient having a prostatic pathology or prostatic condition, disease conditions.
All right. Now, Dr. Shah, is there a role of male hormone supplements then to increase stamina or bodybuilding?
See, fortunately, the young males specifically want to have a good, healthy lifestyle, and they want to build their body mass, which is a very positive thing, either by doing exercise at gym or at the home and having a high protein diet. But many times the young youth is not satisfied with what they gain with the diet and exercise. They want to build more muscle mass. They want to have the 6 packs or 8 packs. And unfortunately, they resort to what we call the anabolic steroids, which is supposed to improve the muscle mass and muscle strength and physical stamina. But it may improve your muscle mass, but it comes at a huge cost. It can lead to the sudden cardiac death, cardiac failure, and many types of malignancy. It leads to the lots of hormonal changes in the body. So you don't have a good body mass at a cost which may cost your life. So it is absolutely unnecessary, dangerous to take the anabolic steroids without supervision of a hormone specialist. Second supplement which patients or the people do is to improve their sexual life or to increase their penile length. Even though they are not deficient of the male sex hormones, they tend to take the sex hormones from outside. So these sex hormones taking outside would suppress your natural hormones, and it will create a lots of problems. It will not definitely improve your sexual function or a penile size, but it will again lead to the cardiac problems, heart failures, and many type of the malignancy. So unless you are deficient of any hormones, taking a unsupervised self-medication with any hormones, specifically any anabolic steroids or the male hormones, is absolutely dangerous. And we all endocrinologists strongly say no to take as such supplements to improve physical or sexual stamina.
All right. And doctor, just, to clarify to viewers, very often we see that these steroids and these supplements are pushed when people are going to the gym. And as you said, it's important that, the people should consult with a doctor before taking any of them. If you could just tell us a bit more about that.
Yes, I think what we recommend our patient is to go to gym, do exercise, take the high protein diet. But before taking any supplement, please consult your doctor. Your gym instructor is not the right person to give you any medication. They are right people to tell you about which type of exercise you should be doing, which muscle exercise you need. But they are not the right people to suggest any supplements, including multivitamins. Sometimes multivitamins contains substances like biotin, which affects the thyroid function test when you do the thyroid function testing. So it is always advisable to take medical advice before you take any supplements suggested by the gym people.
All right. So important to keep that in mind and create more awareness about that. Dr. Das, in order to maintain a healthy hormonal imbalance, what role does lifestyle modification play?
Absolutely. I think lifestyle modification is an important pillar for a good hormonal milieu in a adult male. And if you see the data or some of the studies, like the prevalence of adult onset hypogonadism, what we call it as low testosterone level, has been found to be as high as around 45 to 60% with obesity and diabetes. So if a person is having obesity and diabetes, there is high chances that they will have hypogonadism. And the fat mass is actually inversely proportional to your testosterone level. So if if the testosterone is low, you may gain fat, and if you're fat, your testosterone is low. So in either way, it is correct. So it's better to have a adequate or a perfect body mass index or a perfect weight to maintain a normal testosterone level. And for that, you need a good lifestyle modification. Lifestyle modification, we tell it as diet, exercise, and avoidance of any addiction. So diet is very important, and it should have a wholesome, good diet without any drastic diets or fat diets. It should have good amount of protein, less of carbohydrate, and again, good hydration is also important. Good sleep is also important, and exercise is also very important. So as per the recommendation, at least 150 to 200 minutes per week of moderate intensity aerobic exercise is good enough. With that, 3 to 4 times in a week, if someone is doing resistance training, that is also good. At the same time, we tell the patient to avoid alcohol and smoking, because these are the two things that can hamper the testosterone level and also testosterone action. So lifestyle is absolutely important to maintain a good body weight and a good BMI, so that your testosterone or the hormonal level will be kept at a normal.
All right, well, time for us to slip into a short break, but we'll come back with more questions for our doctors about hormones and male health. Stay with us. Welcome back to our special show, Health and Wellness, and we're discussing how hormonal balance and the role that it plays in our mental and physical health. Let's go across to our doctors now. Dr. Baruah, does male menopause exist? Do males also experience drastic changes during this hormonal shift?
Male menopause is a misnomer because menopause is characterized by a dramatic event, which is the last menstrual cycle. Male will not have that kind of evident incidents in their life. We use a term called andropause. So andros in Greek is male, and pause is the end of it or stop. That means the andropause is a huge long transition, say from the age of late 40s till the late 70s, or you can say up to 80s. There is a gradual reduction of male hormone testosterone, which is about 2% or 1 to 2% per year. So it's subtle. Actually, if for example, a male adult would have 3 to 1,000 nanogram per milliliter level of testosterone, and adult male of 70, 75 years would probably have somewhere around 200. So the decrease is very subtle, and that's why we do not see that kind of events which can characterize by a sudden change in the entire hormonal health of a male person. Nevertheless, because of the subtle changes, also there will be gradual changes, as we have already discussed, the decrease in muscle mass, decrease in sexual capability or desire for sex, or it's called there will be erectile dysfunction, the mood disorders, sometimes leading to depression also. Increased fat mass and decreased muscle mass, the muscle bulk may get decreased and muscles may get weaker, and bones also gradually get weaker. Unlike females, where the bones get weaker pretty early, like 2 decades earlier, male will have probably osteoporotic fracture because of lack of male hormones, probably around the age of 75 or 85. So it's pretty late. So changes are subtle and late, unlike male hormones. So that's how we define and describe andropause, which is a counterpart of menopause in females.
All right, that's very interesting to know, andropause. Dr. Shah, we're just talking about, mental health, and if you can tell us more about that. Can a hormonal imbalance cause depression and anxiety in men, and how can we make the difference between hormone imbalance and depression?
Because of the increasing stress, competitive world, and unrealistic goals, anxiety, depression has become very common among the populations. Certain hormone disturbances can aggravate or can present as the anxiety and depressions. Most common is the hypothyroidism, where the thyroid is produced in less quantity, which can present or aggravate the depression. Just by doing a simple test and supplementing the deficient thyroid hormone, the depression part is corrected. So any patient with a depression can get just the TSH done, And TSH is a very cost effective. It costs only 200 rupees, and you can find out the patient has some depression which is aggravated or presented because of the hypothyroidism. Anxiety, for that matter, can be present with the hyperthyroidism, where thyroid is produced in excess. Again, by doing the blood test and treating the hyperthyroidism can decrease the anxiety. Apart from that, there are certain pituitary and adrenal disorders which can present as anxiety, depression, and lots of psychiatric disturbances. Though it is not a very common cause of psychiatric disturbances, it leads to reduction into the serum sodium values also. So based on the clinical judgment, in a anxious or a depression patients, a routine investigation is not mandatory, but you can always, based on the clinical judgment, we do the lab tests and then we decide the results and treat accordingly. One more important thing about the hormone testing, except thyroid, probably all hormones require specific ways to do the hormone testing. It is not that you go to the lab and ask that, okay, you test my testosterone and the report is below the normal and you start the treatment. It is not that easy. Except thyroid, there are always a certain rules and regulations which only endocrinologist or a proper lab person would know. So don't just, you are suspecting based on the Google that I have some hormone problem, go to the lab and get the lab test done. Better you discuss with your physician or an endocrinologist and then go for the laboratory testing.
All right, so that's important to keep in mind. Now, earlier we were speaking about this, this term andropause, which I think there needs to be more awareness around this. But Dr. Das, how does one diagnose andropause?
Yeah, so that's a very interesting question actually. So andropause or a late onset hypogonadism, as Dr. Manas has already told. So it's not like all patients after 40 or 50 you need to check for a serum testosterone. It's absolutely not mandatory. First, we go by the step actually. If you consult an endocrinologist, there are steps to measure. First, you see the signs and symptoms which are suggestive of hypogonadism. There are many questionnaires, there are many scales by which we measure what are the signs and symptoms, because all these signs and symptoms are quite subtle, sometimes like loss of libido, increase in the fat mass, loss of muscle mass. So they are very non-specific. So we put them in a ADAM questionnaire, or there are different types of questionnaire, and if it is there, then we go for a proper testing of testosterone. And Dr. Shah has already told that it's not like you do a random testosterone to the patient, or the patient comes with a bunch of reports with a general checkup where testosterone has been done. We don't agree to that. It's actually to be done in the morning fasting sample at 8 a.m. and you draw a sample of serum testosterone and you assay in a good lab where it has been accredited lab. You check the serum testosterone, and what we see, if the serum testosterone level is less than 300 milligram per deciliter, not on one occasion. Usually we check for two separate occasions. If it is less than 300 milligram per deciliter, 300 nanograms per deciliter in specific consecutive days or two separate occasions, we diagnose it as late onset hypogonadism. So that's how we go. It is basically a stepwise diagnosis.
All right. Well, thank you so much, doctors, for joining us today on this program to create so much awareness about this issue that people need to know more about. Thank you all for watching at home. Goodbye.